When you take human beings and you say, go into your house, clean all your counters, Lysol them down, you're going to kill 99% of viruses and bacteria, wear a mask, don't go outside. What does that do to our immune system?
Does wearing a mask, a face mask, does it help your immune system?
Now you tell them wear a face mask. What are you doing when you're wearing a face mask? A face mask reduces the amount of oxygen coming in.
Hi everyone, my name is Michael Petrosian. I'm with American Brand. The purpose of this video, I'd like to speak to you about does wearing a mask, a face mask, does it help your immune system? A disclaimer, I'm not a doctor, and the doctors that I'm gonna show the videos and interviews that they explain about immune system and whether or not wearing a face mask does or hurt your immune system. I don't know them personally, I never met them. But what is important to understand is that if you remember from my previous videos, which I'm going to put a link that you can go watch, it's important to understand something very simple. Dr. Fauci in the beginning told the world that there is no reason for anyone to wear a mask. And now wearing a mask is almost mandatory. You go to you want to walk into any grocery store or you want to go to any restaurant to pick up your food, you have to wear a mask. They refuse to let you in. But the reality is that are we a society that we are going to stay as a sheep and slaves without questioning the facts, without understanding the realities? We'll just walk in and say, okay, so they told us we have to wear a mask, so then what they're saying is right. But the question here is that more often than not, people, they go see doctors, and what happens is that they go and they get second and third opinion. Why would you do that? Is because you want to make sure the diagnostic that you got from the doctor, it's correct and it's going to save you. So now what I like to do is I'm going to have you look at doctors. And one of the doctors, actually, she's a scientist and she has a PhD. But I want you to listen carefully to the information that they're giving you. My goal, my purpose is to bring you facts, information from scientists and doctors that they actually today, every day, they deal with COVID-19 patients. And let's see what you think. Go do your own research and find out whether or not this information is valuable. Is it good for you to wear a mask or it's not? Dr. Buttar, who speaks about so many aspects, the importance of immune system and the face mask. Let's go ahead and watch the video.
Now we come to the United States and we come to the current issue. Everything is misinformation. All right. We know that stress increases the cortisol, which is the stress hormone, which decreases the immune system. So when you scare people, tell them to stay home, you suppress their immune system because you're scaring them. You further suppress them because economic issues, they're stressed out. Now you tell them wear a face mask. What are you doing when you're wearing a face mask? A face mask reduces the amount of oxygen coming in. So now your body's in a chronic state of stress. And that face mask is obstructing airway. Just today, I saw a woman that passed out in her car and died, had a car accident and died because of the lack of oxygen from her face mask. They're pushing this agenda, and it's an agenda to make people weaker, to make them more susceptible. The face mask then also prevents, when your body's being stressed out and you're not getting enough oxygen, it then creates other issues. You remember they said don't touch your face and don't okay, well, if you're sweating and you've got the face mask, don't you think people are going to be pushing it around? Okay, on top of that, when you have this release of viruses, because viruses live inside our cells, when they have this release, when I say live, they're not living, but when they're released and you're wearing a face mask, you're preventing the ability you're actually stressing the body out and increasing the viral activation, if you will. All right, so you're actually increasing the susceptibility of the individual stress-wise and increasing the viral load. So tell me, if they really want to help people, why are they telling people that they should be wearing masks? It's completely preposterous.
Now, again, this is the doctor that talks about the effect of the face mask and what kind of an effect it has on your immune system. The next video we're going to watch, which is Dr. Erickson. Dr. Erickson, he has apparently a clinic in Bakersfield, California, and his video went viral. And of course, you know, nowadays that thanks to Google and YouTube, if you come and bring facts and if you bring realities and if you get views, then they're going to censor it because it's not what they want you to hear. But again, since we already talked about all of this information previously, remember that we are not sheep, we are not slaves. We need to educate ourselves. We need to get health education, and we need to wake up and look at the realities, what the steps that we're doing today, what kind of an effect it's going to have on our health in the future. So this video is Dr. Erickson. Please go ahead and watch the video, and we'll talk in a minute.
Now I want to talk about the immune system. Dr. Masihi used to teach for immunology. We both had years of microbiology, biochemistry, and virology studies. We've made it our life's work to understand this stuff. And here, I'd like to go over some basic things about how the immune system functions so people have a good understanding. The immune system is built by exposure to antigens, viruses, bacteria. When you're a little child crawling on the ground, putting stuff in your mouth, viruses and bacteria come in, you form an antigen antibody complex, you form IgG, IgM. This is how your immune system is built. You don't take a small child, put them in bubble wrap in a room and say, go have a healthy immune system. This is immunology, microbiology 101. This is not something, this is the basis of what we've known for years. So what I'm seeing is when you take human beings and you say, go into your house, clean all your counters, Lysol them down. You're going to kill 99% of viruses and bacteria. Wear a mask, don't go outside. What does that do to our immune system? Our immune system is used to touching. We share bacteria, staphylococcal, streptococcal bacteria, viruses. We develop an immune response daily to this stuff. When you take that away from me, my immune system drops. As I shelter in place, my immune system drops. You keep me there for months, it drops more. And now I'm at home, hand washing vigorously, washing the counters, worried about things that are indeed what I need to survive. Let's follow the science. This is immunology, folks. This is microbiology. This is what we've combined together. We have 40 years of experience in this. This is common sense immunology.
So quarantining and social distancing is worse for us, you're saying?
It decreases your immune system. You can't build an immune system by, if someone has a reduced immune system, you hide them away because they can't build an immune system. If you have a normal functioning immune system, you need interaction. When a child is in a womb, you're in this protected environment. When you come out, you have almost no immune system. You develop that through touching your mouth, touching your eyes, virus, bacteria, immune response, IgG, IgM. This is how you build a strong immune system.
Do you think people are worrying too much?
Of course they are, but that's from media telling them to. I am telling them sheltering in place decreases your immune system. And then as we all come out of shelter in place with a lower immune system and start trading viruses and bacteria, what do you think is going to happen? Disease is going to spike. And then you've got disease spike amongst a hospital system with furloughed doctors and nurses. This is not the combination we want to set up for a healthy society. It doesn't make any sense.
So is Dr. Fauci wrong then when he says that Covid-19 is shown to be nearly 10 times deadlier than the flu?
Initially, maybe that was true. But again, I'm going through the numbers. I'm not saying who's wrong or right. I'm going through the science and through the numbers. And I, like you, have been watching media and studying this for 2 months, night and day. I go to bed at 2 or 3 in the morning. Every day I read after my shift and I say, what's going on here? I'm not in an ivory tower. I'm in seeing patients every day and I'm collecting my own data. I didn't have data 2 months ago. I just shared my data. 6.5% of all patients we tested are positive. That's actual, unfiltered, non-political data.
Okay, so now that you watch the video of Dr. Erickson, you have to understand what kind of an effect wearing a mask is going to have on your immune system. You have to understand and you have to wake up, because this is not a joke. This is not conspiracy. These are doctors with years of experience and knowledge. And as you heard Dr. Erickson, he has done 6,000 tests. He's dealing with COVID-19 patients day in and day out. So you have to wake up. You have to look at the facts. You have to look at the realities.
My agenda is very simple, is to inform people, because you know as well as I and anybody that's of reasonable intellect understands that the only way that you can control people is by keeping them in ignorance. But as soon as a person becomes empowered with knowledge, the one thing is that nobody can control you once you are aware. You cannot be victimized once you're aware and once you've been empowered with knowledge.